So then I wasted that blood. Have you guys heard of iatrogenic anemia? Especially in the ICU. So I'm going to show you a push-pull technique that I use to prevent iatrogenic anemia, but you also have to be careful with this technique. ANTT for that technique is crucial.
So you don't contaminate the site, and then?
So then I flush it, beautifully patent, full patency.
Rest of this TP, this alteplase, and we're gonna administer the rest of it and hold it and try to get rid of whatever clot might be left over. So we're gonna do another 15, we're gonna pull back from that site.
So I gave it another 15 minutes to make sure we really got rid of all the clots in there.
There we go. And we're gonna give it another clean because I don't like to see blood on my hug. Pull 15 seconds. Now, even with these, you still want to clamp the proper clamping sequence. All right, so for this one, I'm gonna show you how to do the push-pull method, drawing blood. Take out the needleless connector and flush, very smooth, very patent.
When I flush, that catheter is contaminated with saline.
Pointing it down so that gravity.
But you cannot touch the stem of the plunger. If you touch it, you will recontaminate the inside of that chamber.
These are sterile gloves, just to minimize contamination. It's very easy to move. The less dense.
If I'm contaminating during this push-pull technique, what are we doing when we're administering medications?
Gently, I'm not forcing it, gently re-transfuse.
How many of you apply air into the vial before pulling it back? And if you use the same syringe and you contaminated that plunger or that stem, we're actually contaminating that medication.
The less dense saline will get top, the whole blood will drop to the bottom.
So I'm being very careful only to touch the flange of the syringe and not the stem. And so now I already wasted 20 mLs with blood draw and that clot waste. I don't want to waste any more blood. So I use this technique to draw blood.